Good morning. Thank you for attending today's White Coat ceremony. I am Dr. Michelle Gingras, Associate Dean of Clinics at Palmer College of Chiropractic's Florida campus. Today's ceremony represents our students' transition from the academic classroom to the clinic setting and the next step in their chiropractic education. Today marks the beginning of their patient care career. It is my honor to introduce the president of Palmer College of Chiropractic's Florida campus, Dr. William Sherrier.
Thank you, Dr. Gingras. Well, you all clean up well. I don't recognize some of you. Well, good morning, and welcome family and friends who have joined us today. This program is a rigorous one, and on behalf of our students, the love and support you provide is extremely important and appreciated on their journey. To this class, today marks a significant moment in your chiropractic education, and I want to extend the warmest congratulations to each one of you. As you transition from academics to patient care, you should be incredibly proud of your accomplishments up to this point. The white coat symbolizes professionalism, caring, and trust. Professionalism is at the core of your interactions with patients and is a reminder you have the power to make a positive impact on someone's life. Caring is an essential part of healing, and it is your duty to ensure that the patients that you serve receive the very best of care. Trust is the pinnacle of professionalism and must be earned. Be consistent in delivering exceptional care, and you will earn your patient's trust. This ceremony recognizes the hard work, sacrifice, and dedication you have demonstrated in your preclinical studies. Allow your white coat to remind you of all that you have achieved to this point. Wear it proudly and serve your patients well. Congratulations. Thank you.
Thank you, Dr. Sherrier. I would now like to introduce today's guest speaker, the one, the only, Dr. Norkus.
I don't know if I've ever seen you all in the same room. Got a little intimidated when you walked in. Thanks, Dr. Gingras. Hi, Class 252. Colleagues and the friends and family of the students we're here to honor. I'm truly humbled by your invitation to speak, and don't worry, I'll make my talk short. I thought about pre-recording it, but I was sure you guys would just skip to the end. That went over better than I thought. Too soon? For the audience members attending this white coat ceremony, know that you're here to witness what is one of the largest professional milestones in the lives of the students of this class. Although not graduation, this event is a significant transition that marks the students moving from preclinical education to the clinical application of their academic knowledge. While multiple professions mark this transition with a white coat ceremony, we also include granting a Palmer Crest lapel pin to signify that the students have exhibited the level of professionalism that is required of Palmer College students. As you guys begin your time in clinic, you have a lot to think about. You've made it through quite a bit: COVID-related changes, new buildings, a new campus president, board stress, and Dr. Gonzalez singing to you every other class. But now you'll approach a different set of challenges: recruiting patients, learning the clinic ropes, online coursework, and studying for more boards, to name a few. While these each are incredibly important, please realize that you guys are now in the infancy of your careers. Approach every day in the clinic with excitement, as you'll now be practicing the skills that you want to perfect for use in your own clinics. Just like developing your chiropractic technique in classes and adjusting lab, the clinic mentorship process allows you guys the opportunity to practice and develop your professional demeanor and approach patients and your professional approach to patients and their care. Since you're sitting here, you've already demonstrated the academic competency to work on outpatients. Each and every one of you will continue to add to your academic knowledge, but don't forget your need to connect with patients on a personal level. Remember, most patients don't enjoy the process of going to a doctor, regardless of their specialty. The humorist Dave Barry once said, "I become faint and nauseous during even very minor medical procedures, such as making an appointment by phone." Develop relationships with your patients to help them see your appointments in a more positive light. To get you thinking about how to connect with those patients, I've randomly selected 4 positive reviews of local chiropractors to help you understand what patients truly appreciate during their time with you. Here's the first. Great comfy waiting area, even though there's not much of a wait. Good music playing, super friendly staff always willing to assist. The doctor, which is in quotes, I'm not sure why, explained thoroughly every step and findings and treatment options. His energy and passion for helping others is something you feel as soon as you walk in. Here's the second. I've never met a doctor so attentive to my needs. I've been sending my whole family to see them. The third one is one line only. They spend time with you. Here's the newest. Dr. Ashley is amazing. Our family always feels like their family. She is very good with small children. Her staff is friendly as well. Thank you for always making us feel welcomed. If you stop and think about these, you'll realize that none of them mentions the doctor's GPA, the student clubs they ran, or how many years they were in practice. In fact, the majority of the reviews I found online spent more time reviewing the staff and environment instead of discussing the skill set of the physician. My personal favorite of the ones I shared with you is he spends time with you. Make the connection to ensure your success. Learn from the skill sets of others and begin to practice like those around you that are already successful. Honor the decision your patients have made to see you and do whatever it is within your power to ensure that they have the best experience ever. Remember, as chiropractic interns, you're not only representing yourselves, you're representing an entire profession. Go above and beyond with each and every appointment. None of you in this room would actively choose to see a doctor who was just scraping by with the minimum, so please don't expect that of those under your care. As you prepare to see patients, I want you to remember both the basics you have been taught while not being afraid to think outside the box. To make these considerations easier, think of these 2 quotes from the neuroscientist Dr. V.S. Ramachandran. One of the things we teach students is to listen to the patient by taking a careful medical history. 90% of the time, you can arrive at an uncannily accurate diagnosis by paying close attention, using physical examination and sophisticated lab tests to simply confirm your already existing hunch. Always rely on the history and exam skills you have learned as a first reliable step in the diagnosis of your patients. But realize that as doctors, your skills and approaches should continue to evolve. Here is Ramachandran again, referencing his time in practice. I learned an important lesson. Never take the obvious for granted. Once upon a time, it was so obvious that a 4-pound rock would plummet earthward twice as fast as a 2-pound rock that no one ever bothered to test it. That is until Galilei came along and took 10 minutes to perform an elegantly simple experiment that yielded a counterintuitive result and changed the entire course of history. Please don't be afraid to constantly evaluate your professional views, values, and opinions. This process will ensure that you stay fresh at the forefront of the profession and passionate about seeing each and every patient that walks through your doors. Thank you guys for the opportunity to speak. Good luck during your time in clinic, and don't forget we're here on academic side if you need a pep talk or 2 along the way. Congratulations, guys. Thank you.
Thank you, Dr. Norkus. I would now like to introduce Dr. Heather Bowyer, Dean of Clinics.
Good morning, students, and congratulations. You've reached an important milestone in your clinical education. Today, when your name is called, you'll present yourself and receive your clinic badge. The receipt of your clinic badge is symbolic to your transition into clinic and the important responsibility of caring for your patients. Dr. Matthew Richardson, Director of Clinical Radiology, will be announcing your names. Students in the first row, please line up.
Joshua Abekjer. Lindy Baird. Christina Benson. Blake Carrier. Armando Cedeno Segura. Thomas Chappett. Josiah Charles. Aaron Chavarria. Harrison Coleman. Clinton Collins. Barbara Colon Rodriguez. Olivia Kramer. Vanessa DeMarco. Carolina Echevarria. Matthew Gabriel. Erica Gimmel. Haley Glover. Alexis Hanna. Panus Johnson. Haley Jones. Kristen Kelly. Tanika Lee. Casey Lightburn. Sam Majdinasab. Veronica Marin. Adam Marigill. Gabriel Mash. Matthew McGurk. Lindsay McClellan. Juan Mejia. Donald Morris. Carlos Padilla Rodriguez. Caitlin Pierre. Jennifer Polanco. Macario Samir. Joshua Santos. Ethan Shim. Nathan Smith. Emmanuel Soto. Wyatt Stuckey. Miranda Torres. Spencer Tretter. Varga. Janae Whittemore. Bradford Wolf.
To the family and friends in the audience, thank you for attending today's ceremony. And thank you for the support you have provided to the students sitting before us. And students, on behalf of the clinic administration, we welcome you to the clinic. And we are excited to see your growth over the upcoming year as you transition from chiropractic student to chiropractic physician. Congratulations. That concludes today's ceremony. Students, if you can please remain seated so we can get a group picture, and thank you all for attending.